Dr. Jill Garripoli Pedalino is a pediatrician and the owner of Healthy Kids Pediatrics. She is also the author of 2 children's books, The Universe is Listening, A Children's Guide to Happiness Through the Power of Positive and Mindful Thinking, and You Are Abundant, A Children's Guide to Fulfillment Through the Power of Gratitude and Appreciation. And Dr. Jill joins us now from Sparta, New Jersey. And thank you so much for joining us. I think all of us could use a lot more mental health through all of this. And it's parents. Yeah, but parents are really starting to get worried. We know that for whatever reason, this variant is now spreading quite rapidly and to children. The hospitalizations are real. The numbers may be low, but they are record-setting. What can you tell us about why children are susceptible to this virus? Is it just because it's so much more contagious?
Yes, well, I can tell you that over the past couple of weeks, my colleagues and I across the United States have been seeing an incredible uptick in positive cases in the children. And 7.5 million children have been positive to COVID since the pandemic began, 2.5 million of them over the past 3 months. So it's been incredibly different with this Omicron variant. With the variants mutating and having more mutations to them, it's causing, more effect on the children. And although, as you said, the children are getting more affected, there are more hospitalizations. Thankfully, the cases in healthy children are relatively mild, with fever, upper respiratory symptoms, and they're recovering nicely, thank goodness.
And are you seeing any longer term effects? Because when we talk about kids being sick with these viruses or perhaps even hospitalized, are most of them recovering 100%?
Yes, and thankfully, most of them are recovering. Again, for most healthy children, they're handling this virus very well. However, there is the rare but very dangerous multisystem inflammatory syndrome of children. That can happen weeks to months after a seemingly mild infection, and the complications long-term can really happen even after an asymptomatic infection. So yes, we are seeing some children have very devastating effects from this virus.
And you know the next question here, parents have their kids in the house, they want them to go back to school, they want them to do in-person learning. What is your advice to them in terms of how to keep children safe, especially in some environments where masks aren't mandatory?
Yeah, and if you think about it, these families want their children to go back. They need them for the children's physical and academic and mental health to go back. The parents need to go back to work. So there's a lot of variables here. But yet other families have elderly or immune-compromised family members at home. Sometimes the children themselves are more prone to illness. So there is that very difficult balance that the decisions that parents and school administrators and health experts have to make. The advice is that, of course, we want children to be in person. We know the devastating effects of the children not being in, so we want them to be in. So there have to be a few things that we do in addition to masking. If that's not possible, then of course the distancing, the hand washing protocols, and vaccination. There are tools that we have to help the children go back safely.
You know, I know it's hard in terms of, I don't mean to put you on the spot, but parents will look to you, a pediatrician, to tell them if you have 2 perfectly healthy children, even if you're uncertain about what the safety protocols are at school because you can't guarantee it, would you send them back to school next week?
We have to weigh the risk and benefit. The CDC and the AAP have declared a mental health crisis in our country, in the United States, and that's some serious business. We're seeing more suicide, more severe depression and anxiety, and really the only thing different in the past year or 2 was that children were learning remotely. So I have a stepdaughter who's 12 and she's vaccinated and she is going on Monday to school. And I have to say that the biggest thing that I tell my patients, and they all know this, is that beyond the regular masking and distancing protocols and vaccination, I highly recommend all the time what they can do each day is get nutritious food into their body, get quality rest at night, move their bodies, intentional movement, exercise every day, and vitamin D. Those are things that children can do to build their immune system to keep them healthy while they are exposed at school.
Dr. Jill, that's excellent advice, and I'm sure it'll make many parents feel better, and it feels like they can perhaps take more control of the situation in a situation that has been so out of control for so long now.
It has been.
Dr. Jill, Happy New Year to you. Thank you so much.
Happy New Year, Paula. Thank you so much for having me.